Hello everyone, welcome back to my channel. In this session, I will be continuing with the development of the spinal cord, where we will be discussing about the myelination and some of the common congenital anomalies. So before you watch this video, please do the session which I have already done on the development of spinal cord for a continuity. So first we will discuss about the myelination of the spinal cord. The myelination mainly happens in the late fetal period and in the first year of the postnatal period. And we know the motor neurons are myelinated first before the sensory neurons. When we think about the nerves, there is some part of the nerve which is lying within the spinal cord and some part which is emerging from the spinal cord, right? So the part which is lying within the spinal cord, they are actually myelinated by the oligodendrocytes, whereas the spinal nerve which is emerging out of the spinal cord, they are myelinated by the Schwann cells, and these both cells are the neuroglial cells are mainly derived from the neural crest cells. So that's about the myelination. Now considering the different positioning of the spinal cord, we know the adult spinal cord is not actually aligned along with the vertebral column, right? So during the 8th week of uterine development, we can see that the spinal cord is in line with the vertebral column. But then later what happens? By around 24 weeks, what happened is the vertebral column is actually getting elongated, but the spinal cord is not getting elongated like the vertebral column. So what happens is the lower limit of the spinal cord is up to the level of S1 at 24 weeks. Now by the time the baby is born, we can see that the vertebral column again, the differentiation of the vertebral column is more compared to that of the spinal cord, and the spinal cord is staying as such, and the lower limit of the spinal cord will be corresponding to the level of third lumbar vertebra, L3. Now adult position is the lower limit of the spinal cord will be lying against L1 vertebra. So that is the final position of the spinal cord. So in the initial period, we can see that the spinal nerves will be emerging corresponding to the vertebra, isn't it? But what happens during the adult period, the vertebra which was corresponding to the spinal cord in the embryonic period has shifted its position down. So the spinal nerves have to make its exit by traveling down vertically, then laterally. So that process leads to the formation of cauda equina. So cauda equina is nothing but a group of nerves starting from the lumbar region, then the sacral nerves, the coccygeal nerves, along with the filum terminale, which is nothing but the pial extension. So all together it looks like a horse tail, and that is known as cauda equina. The reason for cauda equina is the differential growth of the vertebral column. So in the beginning, the spinal nerves were making its exit corresponding to the vertebra, and they were just exiting laterally, but during adult period, because of the difference in position of the spinal cord and the vertebral column, they have to travel down and then make its exit, and that is actually resulting in the formation of cauda equina. Now something about the congenital anomalies of the spinal cord, we call it as neural tube defects, and that is mainly occurring when there is failure of fusion of the neural tube or the structures which are covering the neural tubal portion, and that happens usually by 4th week. So what are the coverings of the neural tube? We have the meninges, which is the immediate covering of the spinal cord. Then we have the vertebral arch portion of the vertebra. Then you have the muscles over it, and then you have the skin over it. So any issue with these coverings can result in a condition known as spina bifida. And the severity of spina bifida will be very less if only the skin is involved, and the severity increases when all these neural arch elements are involved. So let's discuss the different patterns of spina bifida. Spina bifida is a favorite short note for UG as well as PG. So you should know the concept first. Okay. So what is spinal dermal sinus? Spinal dermal sinus actually occurs at the region of caudal neuropore by around 4th week. And what is spinal dermal sinus? It is actually nothing but the surface ectoderm and the neural tube will get detached At that point, sometimes this detachment won't occur and the surface ectoderm will be attached to the neural tube. That last point of attachment of the neural tube with the surface ectoderm, if it is not getting detached, you get a sinus at that point, and that is known as spinal dermal sinus, and it is usually silent without any issues for the spinal cord. Now we will see the different varieties according to the different elements of the neural arch involved. The first one is spina bifida occulta. Occulta means we know that the issues with the spinal cord is actually hidden. And instead you will be seeing a tuft of hair in the region of L5 and S1. So what is happening here? The component which is involved here is the vertebral arch. Vertebral arch means the part of the vertebra which is covering the spinal cord in the vertebral canal. So that part is defective. So the vertebral arch fusion has not occurred, but the spinal cord, the covering meninges, everything will be intact and safely secured. It will be seen for the external appearance will be just a tuft of hair in the region of L5, S1. And in very rare cases, the spinal cord beneath and the spinal nerve roots may be involved. The next one is spina bifida cystica. So what do you mean by spina bifida cystica? Apart from the vertebral arch, if you have the meninges or the spinal cord protruding through the vertebral arch, it will be seen as a cyst. So that is known as spina bifida cystica. And according to the involvement of the meninges as well as the spinal cord, it is again subdivided as spina bifida with meningocele, and the other one is spina bifida with meningomyelocele. So spina bifida with meningocele is again not that severe. Why? Because through the defect in the vertebral arch, you have just the meninges protruding out. But spina bifida with meningomyelocele, you have a part of the spinal cord also protruding out along with the meninges through a defect in the vertebral arch. So this is more serious compared to that of the spina bifida with meningocele. Now there is one entity known as meroencephaly. So in meroencephaly, usually when we discuss about the spina bifida cystica and all, only the lower part, that is the region around L5 and S1 is involved. But when we discuss about meroencephaly, several vertebrae will be involved, and sometimes there is also partial absence of the brain as such. So this is more severe compared to the other two conditions. Now, usually we can detect the neural tube defects by an elevated level of alpha fetoprotein in the amniotic fluid of the mother. And by around 12 weeks, if you do UST, it is said that you can visualize the vertebral column of the fetus. So around 12 weeks, if you do UST, the severe conditions like spina bifida cystica can be always detected. Now there is a very severe condition of the spina bifida, that is known as myeloschisis. That is, this is the most severe form. And what do you mean by myeloschisis? Here what happens is, till now we were discussing about the coverings of the neural tube. The neural tube has actually closed and there is no issue with the neural tube, but the coverings of the neural tube we were discussing, and if defective it results in spina bifida. But in myeloschisis, the neural tube itself is not closed. So what will happen? The spinal cord will be just seen as a flattened mass, and sometimes it will be exposed to the outer aspect, or sometimes it will be just covered by a thin membrane or skin, and that is very severe, and the affected person will be having severe problems. And now what are the etiological factors which lead to neural tube defects? The first and foremost is folic acid deficiency, and that is the reason why we actually administer folic acid for ladies who are planning to become pregnant. That is mainly 3 months before they plan to conceive, and it will be continued till the third month of pregnancy, because the neural tube development happens mainly in the first trimester. Now, intake of valproate, that is also related with the neural tube defects, and increased vitamin A intake is also connected with the neural tube defects. Now, I will just sum up. we have seen the myelination, the oligodendrocytes and the role of Schwann cells, then the positioning of the spinal cord, the changes in position from 8th week till adult period. Now the neural tube defects, what are the factors causing neural tube defects, as well as the different variants of spina bifida. So keep watching and please let me know whether it is useful for you. And I would also like to mention about ANASCAR 2023. The details will be shared in the YouTube. Thanks for watching.